Hi, I'm Dr. Pouts. I head the Persephone Healing Arts Center in North Jacksonville Beach, Florida. I'm board certified in internal and integrative medicine. Our phone number is 904-246-3583. And my passion is integrative medicine. And most patients who come to me come because they want to be more actively involved in their own healthcare and use more natural things, including all sorts of different modalities rather than being on prescription drugs only. I'm not against prescription drugs. They have their place, but again, for the common day ailments, there's a lot of natural things that might work even better and have less side effects or no side effects. This video is about Anthroposophic Art Therapy at its best. It's an anecdotal story. We call anecdotal when it's not written up in the journals, and we discuss it as physicians in our patient review cases. So this was a woman. She was anywhere between 18 and 24 years old. She was hospitalized in an anthroposophic hospital in Europe, where we sometimes have entire hospitals or a floor that practices this philosophy. And again, as of last year, the World Health Organization, WHO, has recognized anthroposophic medicine as a legit modality, as they do accept acupuncture and yoga and other things. So this patient was hospitalized with 18 bloody unformed stools per day. She was put on multiple modalities, so art therapy was not the only thing she was on. We had a very experienced, exquisite art therapist. She put this patient on pencil drawing. So art therapy, everything has to be prescribed by the physician. She put this patient on pencil drawing. Pencil drawing is very, linear. You have to go every stroke. You have to form, like if you pencil draw a house or a landscape or a tree or whatever, you have to be very specific how you draw it. This patient's bowel movements were reduced from 18 per day to 1 to 3 relatively formed bowel movements without any blood in them. She begged her therapist to have her do watercoloring. So watercoloring, most of you, everybody has done pencil drawing and watercoloring. You can do crayons, which is sort of an in-between thing, but watercoloring is loose water. You paint one area and it may bleed a little bit into the other one. So she begged to do watercoloring, which is very beautiful because you can work with colors and it's not tight contours like pencil drawing. So the therapist finally gave in. She allowed her to do watercoloring. Within 24 hours, this patient was back to 18 bloody, unformed, loose bowel movements per day after she was given permission to do water drawing. So sometimes in homeopathy, we do similar things here, similar problems. So similar things would be a loose, non-contoured cells that can't keep their own boundary, that are sloughed off and whatever. That is a very unformed, watery process. Watercoloring would be a similar thing. So, but in this situation, it's not homeopathy. This is a little different. This process was able to be formed, so the active will forces from this patient drawing with pencil on a piece of paper, rather than imitating her own process that needed more formation. So the pencil drawing helped her with the formative forces that were unformed and not structured enough and were unable to hold the boundaries and the colon. And this is not an intellectual conscious process, okay? This is just a experience where certain formative forces for us practitioners who work with these ideas, and there's tons of us around, including involving these ideas, that was just not formed. And the pencil drawing helped her, this patient, to get with these formative forces into her bowels to the degree that this was part of the therapy that helped to structure and get this uncontrolled, watery, bloody process under control. So for me, this has been an example I carry in my heart every day when I have to explain to my patients what can art therapy do at its best. I may actually report that example because I think it's unbelievable clear how this works. Thank you for listening to this video. We will be out with more. Thank you.